Hi friends, I'm Kim Adamski, HIV prevention specialist at the Hartford Gay and Lesbian Health Collective. The Health Collective is located at 1841 Broad Street in Hartford, Connecticut. We offer services like STD testing, sexual wellness visits. We have a dental clinic. We do educational programming like this one today. Today we have folks from the New England Fertility Institute as part of our LGBTQ family building series, and we're going to be talking about surrogacy. So if each of you all can give an introduction and what you do, don't fight over who goes first, but
well, I'll go first.
Okay.
So my name is Dr. Lavy, Gad Lavy. I'm a fertility doctor, fertility specialist, reproductive endocrinologist. My clinic is located in Stamford, and I've been in the fertility field for many, many years, over 20 years, almost 30 years now. And over time, we've shifted our focus to basically doing what we call third-party reproduction. And what that means in layman terms is basically surrogacy and egg donation. So it's something that I always was interested in and allows us to work with clients from not just locally, but nationally and internationally. And of course, by the nature of what we do, we work with mostly gay men. I'd say about 75% of our clients are gay men. But we do have some same-sex females or lesbian couples who basically use some of what I will talk about tonight, either egg donation, surrogacy, or some combination. I will explain how the process works, because the way it's done in the US, we basically, if you want to do this, go through this process, you need to choose a fertility clinic and as well as a surrogacy agency. So I think this is sort of a good segue to introduce Karen, who is a surrogate, as well as she works for Caring Hope Surrogacy, which is one of the prime surrogacy agencies.
Yes, my name is Karen Bijeaux. I have completed 2 independent journeys, and now I'm on my 3rd journey with Caring Hope Surrogacy, of which I am also a full-time surrogate coordinator with. We're based in North Carolina, but we're all kind of all over the US.
In the world.
That's who, yeah. Well, I mean, our employees are all over the US, and then we have surrogates and intended parents in the US. We have them in Israel and Spain and Australia, China, they're all over.
wow, that's wild. All right, and Stephen, are you gonna introduce yourself?
Yeah, well, I'll make it brief. I'm Stephen Claphaus, and I'm the Director of Marketing for New England Fertility. I work with Dr. Lavy. Like Dr. Lavy said, the clinic has been, we're in our 30th year, and we actually were the first non-hospital IVF facility in the state of Connecticut. So I like to tell everybody we've got some famous firsts.
Wow, I didn't know that. That's really cool.
Yeah,
all right.
That's sort of dating me.
That's okay. Yeah. So Dr. Lavy, can you tell us like kind of an overview of what surrogacy is, how it works, sort of basic stuff?
Sure. So just to basically just make sure that we're all speaking about the same thing, there's basically 2 types of surrogacy. One is what we call traditional surrogacy, and the other is, we call it gestational surrogacy. Traditional surrogacy, I'll briefly explain because it's something that we don't practice, is where basically the surrogate is inseminated and becomes pregnant. So it's basically going to be her eggs and the male partner or a sperm donor. This is something that is practiced to a limited extent in California, maybe a little bit on the East Coast, but mostly for legal reasons. It's basically not really, it's sort of gone out of favor. And we can spend probably about an hour talking about that. But what we're going to be talking about today is what we call gestational surrogacy, or IVF surrogacy, which basically takes advantage of the IVF technology, which means that we can create embryos in the laboratory using whoever's sperm and whoever's eggs. It's going to be either your sperm, your eggs, donor eggs. And those embryos are basically then placed in the uterus of the surrogate. So of course, the big difference between this and the traditional surrogacy is the fact that the surrogate does not have any genetic connection with the baby. And surrogacy over the years has become more and more popular. And actually, one of the reasons I love what I do is because over time, we're able to help more and more individual couples, straight couples, gay couples have a family. So using this technology and working with surrogates, I mean, you basically are able to, almost everyone who is interested in having a child and is willing to take advantage of all the technology that's out there is able to have a child. And so as the clinic, we basically do certain things and we work very closely with the agency, and we complement each other. So, the connection, the interaction between the fertility clinic and the surrogacy agency is really critical to make this, we call it a journey because it really is a journey, to make it simple, safe, successful. So essentially, I will just explain very briefly how the IVF process works. And I'll explain exactly what we do as the clinic. And then I'll hand it over to Karen, who can explain the surrogacy process, not just from her own personal experience, but also from the agency perspective.
Great.
So the IVF process is basically a process that for this particular purpose, we do in two parts. So the first part is where we create embryos, and we do that using sperm and eggs. As I said, the sperm can come from one of both partners. In the case of a gay couple, it can come from a donor. In case of single women, and then same with the eggs. I mean, for a gay couple, gay male couples, we use egg donors, and for lesbian couples, we basically depends on their egg quality and their age and so forth. We can use their eggs or again an egg donor. And the process basically goes like this: the woman, whoever it is, takes fertility drugs for about 2 weeks. The purpose of the medication is actually to boost up her egg production. So normally a woman would actually ovulate only one egg in a normal cycle. Here, with the help of the medication and doing it really carefully, not to cause too many side effects and problems, we can get an average of about 20 eggs. So those eggs are, after 2 weeks of treatment, the eggs are extracted. The procedure we use to do that is actually quite simple. It used to be a surgery. Now it's done in the office with a little bit of sedation and a vaginal ultrasound. And we've actually come a long way as far as making this whole process very simple, I'd say user-friendly. Especially if we work with egg donors who basically are young, healthy women who basically are doing it to help other people and maybe make a little bit of money. So we want to make sure that they go through this without any complications. So once they're done, after the eggs are extracted, the donor basically, her part is done. We will actually have the sperm available frozen in our clinic before we start. So we have that lined up. And then we basically create the embryos. So we take the sperm and we fertilize the eggs. We grow the embryos in the laboratory for about six or 7 days. And the idea is, of course, when you have these embryos, the idea is to try to identify the best of the best, the strongest of the bunch. So we grow them and we watch them, and then we do some genetic testing. And that allows us to identify a few embryos. So out of the 20 eggs that we get, I would say maybe 4, 5, or 6 of those embryos will be good, or good quality. We call them baby grade embryos. So, and those embryos are frozen. And then usually this part happens first, because for most people, finding an egg donor and providing the sperm it happens very quickly. So those embryos are frozen, and we use the technology that allows us to basically not lose any viability by freezing them and thawing them, and allows us to also keep them frozen theoretically forever. So there's no degradation over time. And then the second part, and this is sort of the focus of our discussion today, is the surrogacy part. So the couple basically will find a surrogate, and Karen can explain how that works. The surrogate basically goes through a screening process, medical, psychological screening, and actually in most cases, the clinic, we will do that. We have our own team that does that. And then once the screening is done and the surrogate is basically accepted, there is a legal contract that's signed, and then the surrogate is prepped, usually with some medications, for what we call the embryo transfer. So that basically starts with her cycle, with her period, and about 3 weeks later, her uterus will be ready. And at that point, we take usually 1 embryo out of the freezer and place it into her uterus. So I say usually 1 because, you know, we worry about multiple pregnancy. We worry about twin pregnancy because those can actually are higher risk. So we try to avoid as much as we can. So just because, you know, nowadays with all the technology, the things that I explained, you get a very good success with 1 embryo. So we expect about 70 to 80% success by placing 1 embryo. So there's really the incentive to do more than 1 embryo in the hopes of increasing the odds is pretty much gone away. It used to be in the past when the success was low that we would put back 2, 3, 4 embryos and hope that 1 takes. Of course, you know, sometimes back then, often none of them took, or maybe 1 took, and sometimes they all did. So we're trying to avoid that because that sort of turns, you know, the whole process into sort of a little bit of a nightmare, because then the pregnancy becomes very high risk, and, you know, you basically what should be a happy ending becomes, you know, could be a little bit of a nightmare. So we transfer 1 embryo, and like I said, we have good success. And 2 weeks after the embryo transfer, we find out if the surrogate is pregnant. So as far as the clinic, right, the role of the clinic, as I said, of course, we do the medical process. We create the embryos, we test them, freeze them. We do the embryo transfer when the surrogate is ready. And we also do the screening of whoever is providing the sperm, whoever is providing the eggs, and of course, of the surrogate. So we want to make sure that they're fit to basically do their part. So the screening is different for the egg donors than it is for the surrogates, but basically at the end, it's our responsibility to make sure that those people who are finally selected are the right people. And I think Karen can explain a little bit more how it looks from her end, but what I want to say that she probably won't say is that, you know, being a surrogate is, I think, is an amazing thing. You know, I think that's sort of one of the best gifts that you can give the people that are going through this, because basically you're giving them a baby, and it's really life-changing. And it's really hard to appreciate that unless you really know these people and know what they've been through and see what happens when they finally are successful. So I always say that the surrogates have sort of a place reserved in heaven. because it's a really an amazing thing that they do.
Yeah.
Definitely. And, you know, I think, and the reason I think, and I'm going to stop talking in a second, but the reason I think it's so important that Karen is here with us is because for many people, you know, doing surrogacy is very scary, very intimidating. And just imagine that you have basically somebody else is carrying your baby. And you have to basically trust them, know that they're doing the right thing, eating the right stuff, you know, not taking good care of themselves. And I think for most people actually, and I always see that because, you know, it was part of our screening process. We will actually introduce the surrogates and the parents to each other in the clinic. And you can immediately see, as soon as they walk in and they see the surrogate, all the anxiety sort of melts away because, again, the women that end up being surrogates are, again, very, very carefully selected. And Karen will tell you how many apply and how many actually are accepted. But I think that's a very important part of maybe this evening is for all of you to actually see a surrogate. Live breathing surrogate. So I'm going to hand it over to Karen. And of course, I'm here if you have any other questions.
All right. Thank you so much, Dr. Lavy. So Karen, where do you want to start?
Yeah, it was quite something to follow. I guess I can kind of just talk about the surrogate side from when they apply, like how he was saying, how many apply with how many actually go through with it, who are qualified. I would say out of 10 surrogates that apply, maybe 5 will make it through the screening process and maybe 2 to 3 get approved by clinics. So it's really, there's a lot of guidelines put out by the ASRM, all the clinics follow all of those guidelines. We follow all those guidelines. And then there's always exceptions for some people here and there, or maybe an extra requirement for somebody else, another clearance they need, or surrogates really have a lot of steps in their medical clearance. There's also, so when they apply, we will do a consult with the surrogate. We'll go over their application. We'll do a consult. I'll ask them a ton of questions about like every part of the surrogacy journey. And then we'll go through the whole process. Then we'll start requesting all of their medical records. Once we get their medical records, we'll send them to the clinic for like a pre-approval. And a lot of the times they'll come back and say, oh, well, they need this extra clearance from this kind of doctor, or we need a more recent PAP. So again, it can get intense with trying to get approved. Once they're approved, we do a home study with the surrogate. So if we can't make it to their house, then we'll do a video chat and they'll walk us through their home. We make sure it's that they have safe home environment, make sure that, you know, basically that they have kids there, you know, that they are just in a safe place. We'll also do background checks on the surrogate and if they have a partner. And that's pretty much the whole screening process. Then we'll go on to matching. So the way we do our matching is we'll send profiles between the intended parents and the surrogates. If they like the profile, which we only send one profile at a time because we don't want to overwhelm people or get hopes up, we'll do a match call. So it'll be the surrogate, her partner, if they have one, the intended parents, and then 1 or 2 representatives from the agency, and we'll go over all of the important parts of surrogacy, like termination, selective reduction, communication, delivery room, breast milk. We try to make sure that everybody's on the same page before we get to the match call, because you want to make sure you're trying to match like-minded people. And then in the match call, we make sure that, again, everybody is on the same page. They can see the intended parents, they can see the surrogate, can kind of connect a little bit. So that's like their first impression of each other. If everybody likes each other, then they are officially matched and we send them off to the fertility clinic. The surrogate will go to the clinic, and like Dr. Lavy said, they will have usually a saline ultrasound. They'll do their psych evaluation. They'll do a ton of blood work. The partner does blood work as well. And then once the clinic gives us the all clear, then they move on to their legal contracts. It's pretty much the same thing as he said. Everybody has their own lawyer. Takes about a month or sometimes a little bit longer for contracts. Once those are signed, we send off the legal clearance to the clinic, and then the clinic kind of takes over with their medication protocol with that surrogate. And the clinics are, especially Dr. Levy, I love the way New England does all of their medication protocols, because they take every surrogate and cater that medication protocol to that surrogate. Like, we have a lot of surrogates that go to New England and they have natural cycles. And then there's people like me where I have a very heavily medicated cycle because that's what I need. So the clinic will make the medication protocol according to that surrogate, and we send them off to embryo transfer.
All right. So I have a question. When the prospective parents are looking at the profile for the surrogate, what kinds of things do they look for? Because like you say, if they like them, but I assume they don't have to be like best friends or anything like that.
No. So the profile has like their basic demographics, nothing like last names or addresses. And then there's a section for surrogate information, a little bit about them, like their job, what they like to do, what their family is like, their siblings, their home life growing up. There's a section about if they have a partner, there's a section for them to fill out. Very basic about the partner, job, kids, marriage. And then there's surrogacy in expectations. So that will ask the surrogate questions like, what kind of communication do you want with your intended parents before, during, and after pregnancy? Questions like, I'm drawing a blank now. Basically communication, termination, selective reduction. They'll put lots of photos in there. They'll put a pregnancy history, and then they can upload a video if they want. It's just an overview of that surrogate, her life, what she wants out of a journey. They're usually pretty detailed.
Now,
and the intended parents will fill out the same thing.
Okay, gotcha. So everybody likes each other.
I think that I would just say that, you know, the Caring Hope, the agency, I mean, they do a really good job in matching because that's really what it is. I mean, you know, there's no right and wrong, and the parents can have certain demands. The surrogate may have certain demands. The surrogate may basically decide, I mean, this is something that comes up all the time, that she'd rather not get COVID vaccine. This is sort of a very hot topic right now. So of course you have to match them up with parents that feel the same way.
Gotcha.
So things like that. And, you know, you want to make sure that they're the same, I'd say, temperature, right? Because all the parents want to be in constant contact with the surrogate. And if that's what you want and the surrogate doesn't feel the same, it can get a little annoying, and vice versa. You know, some of the parents basically want to have the baby and they're not really that interested in having a relationship. And that's okay, but it's not for every surrogate. There's some surrogates that are more into it and want to have a relationship. So I think it's a little bit of a juggling act and a little bit of an art to basically find the right combo, the right match.
So how do you handle like relationship management between the surrogate and the couple or intended parent?
So we are very, we take a lot of time to get to know the intended parents and the surrogates beforehand. Our intended parent coordinator and the co-founder that deals with intended parents mostly, they form good relationship with them and make sure they know exactly what they want. And I do the same thing with the other co-founder. So we make sure that the personalities we're matching are going to mesh throughout the whole journey. Of course, anything can happen. Maybe something happens and somebody changes when if there's any rifts in the relationship, then we as an agency, the appropriate side, will kind of jump in and try to moderate. It doesn't happen very often because we really, really try to make sure we match people who are like-minded. Usually the surrogates and intended parents will take their relationship private, their own messaging, and we don't try to interfere with any of that. We don't try to micromanage their relationship, but if needed, we're there at the agency for them.
Okay, that makes sense. So it's kind of, you set it up to people that will have similar desires for communication, and they handle it from there for the most part.
Yeah.
All right.
Because, you know, if you set it up properly, then it's easy. Then you don't really need to do very much.
I mean, it sounds like you all have quite a bit of experience, so.
Right, yeah.
All right. So how did you, Karen, get interested in surrogacy? If you don't mind speaking on that.
Sure. So it's very, very simple. Like, I just had my 2 kids pretty close in age, and I was very blessed to have easy pregnancies and deliveries. And my OBGYN at my 6-week checkup asked me if I wanted to be a gestational carrier. So I did research for about 10 months, and then I went on to find my first intended parents online.
Wow.
That was, yeah. My OBGYN was very, very supportive, and he just suggested it and I ran with it.
Mm-hmm. And he suggested it because, like you said, you had pretty easy pregnancies?
Yeah. And he was
sense.
like, you know, you could help so many people. So I was like, well, I guess I can do research, which research is very important in surrogacy. Even if you're going with an agency, please do your own research on anything that you could. I mean, we're here with lots of information, but I always encourage surrogates to do their own research as well.
And how did you end up becoming a coordinator? You're a surrogate coordinator? That's your position?
Yeah, so I did my first 2 journeys. And then my second journey was independent, and we have like Facebook transfer groups for surrogates. And I met Nicole and Charlene, who are the co-founders of Carrying Hope. And we all became close friends during that journey. And they co-founded Carrying Hope. And when they got to the point of needing help, they hired me, and I didn't even apply. They just said, Karen, you're going to help us do this now. And I was like, okay. And it has been the best thing. This is my final surrogacy journey, just for personal reasons. And I have lots of feelings about that, but I'm very grateful that I get to help other people in our agency after that.
Do people typically do multiple surrogacy journeys, or usually just one? How's that usually go?
I'd say it's probably about half and half. We've had several of our surrogates come back for a second journey, and some people are just one and done. I just want to do it once, just to, you know, say I did it and help someone. And then there's people like me that we get addicted to it, and we just want to have all the babies for everybody because these intended parents start talking, and we just want to help everybody.
I know the feel of wanting to help everybody, but that is really great. Now, obviously, for a lot of people, I don't want to generalize, but for a lot of people on both sides, the prospective parents and the gestational carrier, there's a lot of probably emotional management to deal with. Is that something that the agency connects people with, provides, anything like that?
So we have a Facebook group for our surrogates for support, that if they need anything, if they need something more, like if they need someone to talk to, like a therapist, we can help set them up with somebody. A lot of the times the intended parents are very wanting their surrogate to get help if they need that help. So they'll help as well, look for a therapist or something. But most of our surrogates they just kind of talk to each other because everybody can help each other through the journey because we're all going through the same thing.
Mhm.
So
the social support really does it for most of them.
I would say so, yeah. And then
Okay.
everybody at Carrying Hope has been a surrogate 1, 2, 3 times. And so anything that somebody's going through, I can find someone that has gone through that can talk to you.
Mhm. Now, what do you all look for in a prospective parent or parents?
Look for like
I mean,
personality.
I assume that you they have to get certified, right? By clinics and whatnot. Like you can't just like walk into a surrogacy agency and
yeah.
say, hey, can I have a baby?
Yeah,
So what
no,
kinds of
they,
things are you specifically looking for?
Some people come to us and they have no idea where to start, and we'll usually say, let's find you a fertility clinic, because that's your first step, is going to a clinic, finding out all of your options, getting established, talking about embryo creation. But with us, we do a consult. So our intended parent coordinator, Katie, will do a consult with the intended parents on Zoom and kind of go over the entire process with the intended parents. And give suggestions, advice, tips. And then our screening process, we do background checks. We get to know them. They do their profile. We connect with their fertility clinic.
Okay. Now, I know you said that you all mostly 75% get gay male couples, excuse me. How often do you get trans folks? Because I imagine some trans folks are in need of a surrogate as well.
That would be a question for our intended parent coordinator.
Gotcha.
I'm not
that makes
sure.
sense.
Yeah,
I can say that, it's not a lot, but we just actually saw a couple that she's a trans and they're basically ready to have a baby. So we're using his sperm and an egg donor and a surrogate.
Okay.
So to your question, it's like I said before, every case is different.
Right.
Every journey is different. The people come from different backgrounds, different experiences. So I think that's, again, as I said, you have to be open and you have to listen and you have to find the right solution for them, because if not, it's so, yeah, you're right. You ask, how do you vet the parents? So, surrogacy, or egg donation for that matter, or even IVF is not for everybody.
Right.
And, there's certain things that we always check, like, for example, maybe they're too old, right? And what impact that could have on the baby, on the process, future.
Gotcha.
So there are many things that are clear cut, right? That, but there's actually probably more things that are not. So things that you have to sort of assess and decide if that's the right thing for that particular individual or that particular couple.
Okay, gotcha. Now, I have another question, I think, for Karen. So something I hear from people sometimes is like, me and my husband want to have my sister be a gestational carrier or something like that. Is that something that is done like somehow through an agency, or is that like how is that allowed and how does it work?
Yeah, it's allowed. We actually, one of my latest matches, they're so sweet. I love them. It is a cousin caring for her aunt and uncle. And some people use an agency just because we can facilitate the whole journey and make sure that every detail is done. Some people don't use an agency, and if you don't use an agency, you have to do a lot of research, but some people don't. But absolutely, you can carry for a family member. I think it is so special. Not that it's any more special than other journeys, but it's cool. I think it's really cool when they have a family member that is able to carry for them.
Right. Yeah, I've heard both. I know one couple I know is like, I don't want to have that, like, to change the dynamic in my family relationship. But the other couple I know who wants to do that is like, it would be really nice to have somebody, like another member of the family involved. So.
Well, I think that, you know, in these cases, so for example, I just actually had we have a really good case right now. So this is a gay man, and they need an egg donor and they need a surrogate. So the egg donor is one of their sister of one of them, and the surrogate is the sister-in-law of the other one. So, I mean, I thought it was just the most amazing thing, because it's like, it's really, I mean, just first of all, it shows you that there's like so much support of the family for the process. I think I told them I thought it was the most amazing thing, but also at the same time, you have to be really careful, because it's true, these people, I mean, they're not going anywhere.
Yeah.
So you want to make sure that everyone understands. And I think the counseling, the psychological screening that we do for those kind of matches is probably a little bit more intense, just because, again, you want to make sure that you're not creating something that time bound that's going to be a problem down the road.
Right. Yeah. Understandable. Okay. So, how would you say, Karen, that how does it feel different to carry somebody else's baby as a gestational carrier than your own baby? I mean, obviously you can only speak for yourself, but you know.
Yeah. I think I hear a lot of women in my consults say that they don't feel attached to their baby. I mean, they know the baby is there, but then, you know, when they give birth, it's, where am I want to go with that? So for me, when I had my babies, I just I don't want to say it felt different. I mean, it's still a pregnancy, but like, I love these surrogate babies, but I love it like an aunt. I love it. It cries and I give it back to mom and dad.
Like babysitting.
It is basically extreme babysitting, where you have to have so much trust in your surrogate. So I don't necessarily think that pregnancy wise, it feels any different, but just knowing that I'm going to give them, you know, their baby back, because we always tell surrogates, you are not giving a baby up, you are giving their baby back. And so just thinking about like the end result and the look on their face, it, I don't want to say detaches, because I don't think surrogates get attached to pregnancy. I never got attached to their baby, but just our focus and our highlight of that journey is the look on their face when they are with their baby. It is the moment of the journey. So I don't think it feels different physically, but like just mentally, you know that you're helping someone in the biggest way.
Mm-hmm.
Does that answer that?
Oh yeah. Yes.
It does. I think it does.
Yeah, no, I think so. That's interesting how you can, I guess, compartmentalize that.
Well, not everybody can. And those are the people that are like, oh, I could never be a surrogate. I'm like, that's okay.
Yeah.
It's not for everybody. It's okay if you couldn't do that.
Gotcha. So does that ever end up being an unexpected problem for gestational carriers, that they unexpectedly feel attachment or have any kind of emotional issues because of that?
So I have been in the surrogate community since 2014. I don't think I've ever seen anybody get attached and want to keep that baby. We want to give them their baby. We love it like an aunt. Again, it cries. We give it back to mom and dad. It's not our baby. But
gotcha.
You know.
Yeah.
But, you know, I think from the parents' perspective, I think many of the parents, even if they don't verbalize, they worry, right? That, you know, maybe the surrogate is going to want to keep the baby. So that's sort of a very common question, a very common concern. And what I tell them, I said, listen, I think it's more likely that the surrogate will actually worries that you're not going to come and pick up the baby.
Oh.
So in our profile, there is a question about what reassurance can you give the intended parents about this journey? Basically saying, how can you tell them that, you know, you're in this for them, you're not gonna, you know, you're gonna give them their baby, and, you know, we don't want your child, we want to help you have your child. And there's so much trust involved in surrogacy. I mean, so much. I mean, you could live in California and your baby is in Florida, and you don't know what's going on with your child in that woman's uterus. You don't know. And so it takes a lot of trust. And I don't personally know as an intended parent, but I can only imagine how hard that is.
Yeah.
You know, and there's only so much we can do as surrogates, you know, to reassure the intended parents, like, I'm going to take as good of care as I possibly can. We all give it the same care as our own pregnancies. And, you know, we send them heartbeat videos, like the Doppler at the doctor. If we can video chat in for ultrasounds, we can. We send bump photos if they want. We ask if they want bump photos. We don't just offer it because you never know. But we try to include our intended parents as much as they want to be involved, because they don't have any control over it. So we really try to give them as much involvement as they want.
Now, do intended parents more often live very far away from their surrogate, or is the case usually that they live closer? Like, does it vary?
Local surrogacy is not as common. My second intended parents only lived an hour away from me, and I consider that local. We do have some local matches in Tennessee, but then we also have like a surrogate in Indiana and her intended parents are in China.
Whew.
And we have a surrogate in Utah. Her intended father is in Australia. So everybody's just all over.
Right.
That's so cool that we can do that now.
Yeah, we work with intended parents all over the world as well. And so if they're working with a surrogate, I mean, the surrogate's on the other side of the world. So there's obviously a lot of trust, but, you know, in the evaluation and in the vetting process, it's very important, you know, and it's a very careful process to make sure that everybody is emotionally healthy and prepared for this. And so a lot of that is really figured out beforehand, and surrogates have their own families already. So they, you know, often are in the situation, they don't want to bring your baby home. They have their own babies.
Yeah, they have to deal with those already.
So they're not there to take your baby home. And the other thing, there's a consistent feature of the surrogates and the egg donors we work with. And of course, they're compensated. And of course, that's certainly a motivator. But the one consistent feature of all of them is they're all super passionate about helping other people have families, especially, you know, when we're talking about a same-sex couple that otherwise couldn't, well, because it's physically impossible, or because legally in their own country they can't do it. You know, it's that sort of thing that it's a lot of the egg donors and surrogates we work with are passionate about helping people do what they otherwise could not do. And I think that is what keeps it from being a problem. They want to give that baby to you. It's important to them, and it's important. And the egg donors have the same mindset. It's not just about the compensation; it's about helping people.
I love that. That's beautiful. So we have, well, we had two audience, but we have one audience member now. And I want to throw any audience questions. Just no pressure, though. I know, being the sole audience member.
And I just wanted to say one more thing about about surrogates being in the right emotional state, like Stephen said. The psych evaluations are very, very thorough as well. The psychologist will meet with the surrogate by themselves, with their partner if they have one, meet with the intended parents, meet with everybody together. The surrogate does a PAI or an MMPI, which is like a 300 question test. It takes forever. It's very redundant, but we all do it. And not everybody passes psych, because, I mean, the psychologist absolutely will say, I don't recommend them to be a surrogate if they don't feel that they are in the right mindset. We've had several that don't pass. Sometimes the intended parents could ask for a second opinion, and sometimes they just don't move forward. So that is also a very large part of screening, and making sure that your surrogate is in the right mindset for surrogacy, as well as their partner being supportive.
Yeah, I imagine that the psych evaluation is almost as, if not as important as the physical health, for sure. Oh, I got somebody, our audience person said he wants to thank everybody for sharing. He had questions, but you just answered them. So awesome, very thorough. All right, so I mean, I guess it's about time to wrap up. Thank you all so much for coming and talking about this, because I mean, I know very little about this subject. I just learned a ton, and hopefully the folks who joined us did, and the folks who watched this video in the once it's uploaded do. Before we go, I just want to reiterate, I'm Kim from the Hartford Gay and Lesbian Health Collective. If you have questions about sexual health or our programs, our number is 860-278-4163, and you can also email me at kim@hglhc.org. Now, if any of our guests, Karen and Dr. Lavy, have contact information that folks can contact them with questions, would you mind sharing?
Yeah, so, you know, our clinic is called the New England Fertility Institute. And like I said, it's located in Stamford, Connecticut. The phone number is 203-325-3200. And their website is nefertility.com.
Great.
Yeah, and so at Carrying Hope Surrogacy, you can reach me at 828-553-8200, and my email is karen@carryinghopesurrogacy.com, and I can redirect you to the intended parent coordinator or talk to you about the surrogacy side. Yeah.
Okay, great. Thank you so much to Karen and Dr. Lavy, and also to Stephen for coordinating. That was very helpful. So yeah, everybody then have a great night, and this will be uploaded to YouTube and Facebook within the next couple of days. So if you want to share this with anybody, then
Sure,
it'll be available.
will do. Thank you very much, Kim.
Thank you.
Thank you. Have a great night,
Thank you,
friends.
Karen. Good to see
Bye.
you.
Bye.
Bye-bye.